la vida colectiva.
character of multiple spaces of
Puedo
our collective
decir
life.
con toda convicción que
I
él fue
can say with all
un
conviction
gigante de la
that he was
vida,
a giant of
un
life,
gigante del
a
pensamiento, un
giant
gigante
of
de la
thought, a
acción.
giant of
Y en
action.
todos y cada uno de
And
los
in each
campos
and
en los
every
que él se
one of the
desarrolló,
fields in which he
invariablemente
worked,
sembró para el
invariably
futuro
he
y
planted for
dejó
the future,
huella profunda
and he
en
left
las
a deep
instituciones y los
mark
programas
on the
en los que
institutions
sirvió.
and programs in which he served.
Nunca, jamás pasó
Never
desapercibido
was
y
he did
siempre,
he pass
siempre aportó.
inadvertently, and
Por
he was
eso celebro
always
que en
present.
esta
So I
oportunidad se
celebrate
le
that on
rinda
this
un
opportunity
homenaje,
we
que le
give him
rindamos un
homage
homenaje
and
con la
recognition
presencia de
with
todas,
the
todos
presence
ustedes y por supuesto con
Darrell,
la participación de quienes van a formar este conversatorio.
those that will be in this conversation. Dr. Soberón was a professional in everything that he did as a physician. See, okay,
Administrador de servicios de salud, político, amante del deporte. Él destacó en estos y otros campos, varios más, por su genio, por su capacidad
see,
de convencer
in the
gente,
capacity to convince people by the principles that he defended at every moment, and for being a man who made decisions, um, a convinced university academician, and fulfilling multiple roles and functions during his life. He was a mentor, a guide for many of us, and he was undoubtedly an indisputable leader when, especially in the institutions, it required his intelligence, his capacity, and his determination. He was an exemplary academician, an academician who demonstrated his love for his alma mater, the National Mexican University, when he said, and he repeated with certain frequency, he mentioned it to me. Look, Nato, you may see somebody that loves the university as much as I do, but there is nobody who loves it more than I do. It is a great pleasure for me that this recognition is occurs a moment that coincides with two other aspects. One, in the introduction, it was already mentioned that it coincides with the celebration today, the 23rd of October, of Physicians' Day, for all the professionals of medicine, to say that the Mexican Medical Society is proud, undoubtedly, of the performance and work that every day, systematically, they carry out. And in particular, the work that they have been doing with the rest of the healthcare workers in the face of this pandemic. I express my sincerest congratulations, and for me, it is a great satisfaction to be a part of that group and that vocation of service and commitment to the population. But in addition, today we have another circumstance. The sessions of the Knowledge and Transformation Forum are coming to an end, organized by the Better Health Program in Mexico, by the British Embassy, and the auspices and cooperation of the Medical School of the Mexican National University, and with the participation of many other organizations and structures of professionals and academic healthcare areas, institutions, public and private, so on. And for that, I am very happy. To the organizers of the forum, my sincerest congratulations for your initiative and for conducting this forum to a happy ending, as we can see in a few moments. It is my honor of accompanying three personalities. It is a great pleasure from the world of health and Social Security. We have with us Dr. Jose Ramon Cosillo, who is an attorney. He is a jurist, a complete jurist, who did his studies and bachelor's, master's, and doctorate in the legal field. He is one of our national experts in constitutional law. He is an authority in the subject recognized nationally and internationally, and a great academician. He has a national award winner of our country. He is a member of the National College and many other academic organizations. So it is a privilege to share this conversation with him. We have with us also Hector Valle. Hector Valle is a professional very closely linked for many years to the healthcare field. He has done this in the public institutions as well as private, in the pharmaceutical field or in the field of patient care. He has done it supporting the development of human resources with academic institutions of great prestige, such, and just to mention an example, the Monterey Tech, the Institute for Technical Studies in Monterey, or the medical school of our National Autonomous University of Mexico. He is a person that has contributed importantly in this regard, and that for the last 3 years, he has functioned as a splendid president, executive of the Mexican healthcare. I have left for the last of the introductions to the host that is receiving us today in this virtual space, but with tremendous significance in the reality of our country. Dr. Eduardo González Pierre, he is an expert, one of our experts in the field of economy and health. He has enormous experience in the health ministry and in the Mexican Social Security Institution, and also in organizations of the private sector, in organizations of the social sector. Today, we have the good fortune of having 2 executive directors of healthcare, Hector and Eduardo. He studied economy or economics and mathematics in the University of Washington and was trained in the master's and doctorate in the University of Chicago. He has a lot of written publications and has made tremendous contributions in the health sector, as we will see later on. So I will give him in the first place the intervention so that he can give you a message on these other 2 topics that have brought us together today. A recognition for the healthcare society on the one hand, and a brief comment regarding the forum that is coming to a conclusion today. Thank you, Dr.
Nos da muchísimo gusto que podamos cerrar esta jornada tan intensa de 3 días con este agradecimiento y reconocimiento tanto al doctor Soberón por su legado.
It's our pleasure to close this session with a recognition to Dr. Soberón and so many.
Yo quiero empezar por tratar de reconocer, tuve el privilegio, por supuesto, cuando estaba en la Fundación Mexicana para la Salud, hace ya algunos años, pero desde antes de conocer al doctor Soberón, y diría que su legado ha sido tan amplio, tan diverso, tan profundo, pero algo que a mí me sorprendía durante los muchos años que estuve trabajando en la Secretaría de Salud, en el Instituto Mexicano del Seguro Social, y generalmente interactuando con instituciones y personajes del sector salud, lo común que era hacer
how
referencia
common it was
al
to
doctor Soberón.
refer to Dr.
Es
Soberón.
decir, uno entraba a una sesión,
We would
hablaba
go
del
to a
Instituto
session
Nacional de
and
Salud
talk about the
Pública,
National Public Health
los temas de FunSalud, por
Institute,
supuesto la UNAM, lo cual no voy a abundar en
obviously
eso porque
the
tenemos a
United, the
uno de los mayores expertos, pero siempre había un tema donde decía, sí, eso fue la participación del doctor Soberón.
The participation of Dr. Soberón. Dr. Soberón did this, he thought this, Dr. Soberón created this, and so on. It's difficult to be part of the healthcare sector without being directly or indirectly touched by his work and his legacy. Let me go back and mention the excellent 10 sessions that we have held that have had to do with education and training, particularly around the most important element in the healthcare sector, which is all of its professionals, not only the physicians, but also the many male and female nurses and healthcare professionals that work in a very dedicated way so that all Mexicans can be healthier and live longer. But I would like to link this to the Physicians' Day and the legacy of Dr. Soberón. As regards this session, there are two things that I would like to highlight. First of all, he's concerned about equity-related topics. I'm sure that Dr. Cosigo will further address this. But one of the most important legacies he had was to conceptualize the fact that one of the ways to achieve equity in Mexico is to start by health. And one way to try to achieve health equity is through the rights that Mexicans have of health protection. I think this was understood. It was mentioned in the previous sessions. To try to achieve health equity, we need to begin with the equity of rights. This represented a watershed for many of us who later on participated in some reforms trying to operationalize this right to health by means of having a budget so that the budget could become access and access could become services. This is an extremely important legacy, the equity vision that begins with the constitutional part. And another brief aspect that I would like to mention only briefly, which is decentralization. I believe that Dr. Soberón visualized, and he was very much marked by in this decentralization experience with his experience regarding the capacity and spaces when he was the dean of the National University. So he wanted to bring that experience from the university to the Ministry of Health. He started by saying, to achieve equity, we need to generate capabilities in the states. They need to receive more power. They need to be co-responsible and co-participants of the healthcare system. And this needs to be done in a very active way. Together with this, we need to provide them with capabilities. We need them to have competencies so that they can enact the constitutional right to health. They need to be capable, they need to have power, they need to be healthcare professionals that are knowledgeable of the problem, of the practice. And I think that those two aspects have interacted. In this forum, the capability, constitutional law, constitutional right to law, and generation of capabilities and competencies throughout the national territory. I will end here, Dr. Narro, and I pass on the floor to you. Thank you very much, Eduardo. I would like to first of all give the floor to Hector so that we can hear from him and his experience with Dr. Soberón. Then we will give the floor to Justice Minister Cosio so that he can address certain specific topics. Of course, that I'm referring to the inclusion in the Constitution of the right to health protection. Your general view about Dr. Soberón. Many thanks, Dr. Narro. I would like to thank my panel colleagues, Dr. Cosio, Dr. Gonzalez-Pier. It's a pleasure to participate with you today. I would like to begin by congratulating the physicians and the entire healthcare staff and thank the commitment that has characterized you, Dr. Narro, and other physicians that you represent. It's very special to do this on the Physicians' Day, particularly given what has happened in the COVID area and having this recognition to Dr. Soberón. There are 7 aspects that I would like to emphasize. Dr. Soberón, first of all, did something that only a few can do. That is to say, solve problems. That sounds like too little, but it's in reality too much, and it is substantial. He undoubtedly modified structures. He modernized the legal framework that Dr. Cosio will mention. He created new institutions. He promoted research, which is a very important job that he left to the foundation. Something else is how is it that he recovered from the different backlogs of installed capacity. He achieved the first loan from the Inter-American Development Bank that allowed us to build health centers and then general hospitals. And he trained many who then were future managers or administrators in the healthcare system. And they have all helped us direct the healthcare system. Later, I would like to speak about research, and I would like to tell you how do we regard it from the foundation, his modernization, and there is a special chapter about FunSalud where we remember him and we love them, and the public-private partnerships and relations that have served as a framework, not only in health, but in areas that go beyond health. Many thanks. And yes, of course, we will later address all of these topics. But before that, I would like to ask Dr. Jose Ramon Cosio to tell us about that moment and what has happened since then. In December of 1982, under the coordination of Dr. Soberón, the House of Representatives or deputies received an initiative to add the right to health to our constitution. And that triggered a series of changes in our standards in the secondary legislation. This eliminated the old health code that was already anachronical, that had not been updated for many years. And we, in fact, had after that a General Health Act. You are an expert not only because of your very clear interpretation of the Constitution, but also because particularly in the field of health, we have welcomed you at the National Academy of Medicine and at many other institutions as one of us, as one of our partners, as an ally from the law sciences that favors health sciences. Your viewpoint, Jose Ramon. Of course. Good afternoon. I would also like to begin by congratulating the male and female doctors in our country, where we are celebrating them, particularly because of their effort of always, but particularly because of their hard work during the COVID times. A very interesting point that I discussed with him was the transition between being the dean of the university and being Minister of Health at the beginning of President Lamadrid's term. He told me that he had been working very hard with many people during that transition period between being dean of the university and Minister of Health. There he was able to construct, to design, and to establish what he thought would be the national Mexican health system. And he began in the right way because he modified the Article 4 of the Constitution, establishing the right to health protection. The following year, and I'm sure he had planned this model very well, the General Health Act that has already been mentioned. I believe that, yes, this in fact represented a very important trigger. If we take a look at the current Article 4 of the Constitution, we will find a large number of what we call third generation rights, social and economic rights. They are given different names. But this started in a solid way with the right to health protection. And after that, everything occurred as a cascade. I believe the model was not only an attempt to generate the right to health protection, to give all of us Mexicans having better healthcare access and better quality of life. I think that the structure that the previous speakers have referred to was very well planned. This act was very important at that time. It establishes a coordination system. I believe that this is a law that includes very advanced aspects that were then taken to fraction 29 and went from A to Z in Article 73 of the Constitution. It has to do with all of these aspects. So I think that, yes, Dr. Soberón had an extraordinary vision of what he intended to do. On the other hand, let me say this, he surrounded himself by people that were very well known by constitutional law, Diego Valadez, Jose Antonio, Mr. Ruiz Massieu, and others who worked with him and worked around laws and standards. I think that this explains to a great extent the success of the Mexican model. After that, other developments have occurred. We've had other ministers, other presidents, other national needs. But it seems to me that we began with a very solid base, which is due to the great wisdom, work capacity, and work and execution capacity that Dr. Soberon has. I coincide with you, and I mentioned the legal part simply. Thank you very much, Mr. Minister. Hector, in your initial comment, you already said that Dr. Soberon had the vision, the capacity, and the conviction of understanding that a country like ours requires, of course, the public part, but also the private part, and that the sum of these efforts represents one of his virtues. That's why, among other things, he started in the mid-80s, Fun Salud, the Mexican Health Foundation. This was really a role model on how it was started, how it was established, and how this social institution has grown. I'm referring to the Mexican Foundation for Health. You have a very fresh vision because you are the executive president right now. Please share with us your thoughts about your most recent relationship with Professor Soberon, who was always asking about how his Full Salud was doing. Yes, I had the pleasure of coming to Full Salud initially to take care of something when several changes were occurring. I came here as an interim president. Not half an hour had elapsed since I arrived in my office when Dr. Soberon said, the interim part of it does not exist. So please remove it so you will be the president for as long as it's necessary. I did know that I had arrived as an interim president. I thought it would be for 2 to 3 weeks, but his intention was that I remained as the president. For many, many weeks, I would have coffee with him every week at his home to learn about the mandates of what I had to do and the responsibility. The clarity of Dr. Soberon was always impressive. He told me there are 3 things that we need at the foundation. First of all, when you come to the Ministry of Health, you have no time for planning. You have to execute. So you need to be in charge of the planning. Second, there is a very profound commitment with research, and you need to take care of providing support to researchers. And thirdly, you need to find how to add the public and the private. When he spoke about research, it's interesting to give certain examples that he mentioned, but please pay attention to his vision. At that moment, while at the Ministry of Health, he worked very much on research, and he charged us with doing research together with the National Institute of Pediatrics to speak about nutrition and genetics. This sounds like something that is very familiar to all of us in 2020, but this was already in 1985. Also, with the National Institute of Respiratory Disease, he spoke about environmental pollution. This is a period when we did not hear much about pollution. With the National Cancer Institute, he wanted us to do research on molecular biology. This was more than 35 years ago. With the National Institute of Neurology and Neurosurgery, about neurochemistry, just to cite a few examples. Our task was very clear, as Dr. Naro said. The vision of FUNSALUD was born in 1985, but it was in 1989 when FUNSALUD became a full institution. We have worked along the line that he requested, working along human resources training, promoting development of technological innovations, and of course, contribute to better knowledge of the problems in our country, so that this can generate both technical models and methodologies that can improve the healthcare system and that can provide us with a better public health policy. And in the case of Mexican scientists, he was also ready to work on this. I think that public-private work deserves his recognitions of adding things and putting things together, because Mexico is one. But in the end, it's your Mexico, my Mexico, all of us Mexico, but it's responsibility for all of us. And he had the vision of adding things and putting things together. I mentioned a few people. Sorry if I omit someone. I will always omit someone, but he worked with Carlos Saavedra, Guillermo Salas, Alfredo Santas, then with architect Jose Alfredo Santas, Enrique Robinson Wurst, Manuel Aguilar, Manuel Martínez Domínguez, Jasme Contantiner, Pablo Escandón, Carlos Eduardo Represas, with Pedro Ramírez Vázquez, Ernesto Rubio del Cueto, Antonio Gutiérrez Cortina, with Antonio López de Silanes and María Luisa Barrera de la Serna. This work was exemplary. A bit before he passed away with Eric Haas, he shared very good discussions. I think this is a very good example of joint public-private work. And now we have been able to head this in the strongest part of the pandemic. We have tried to sum the public and the private efforts. So my thanks to Dr. Soberón for his vision, for this very strong charge that we have with us, and we are working to make it a reality.
Thank you. Thank you. Before we move on to another great chapter, because we could not have this conversation if we didn't touch the issue of higher education and culture. And here I am going to ask Minister Cosillo for some reflections. But before moving on to that, just to touch this topic, which was really one of the great concerns, as has already been mentioned by Eduardo and Hector, of the human resources, a great chapter in the life of Dr. Soberón. And since Eduardo worked very closely with several ministers, and particularly at a time when there was another transformation in the field of health, it had begun with the decentralization by Dr. Soberón, and it continued with Dr. de la Fuente in a notable sense. But Eduardo, you were present when some changes, substantial changes occurred in the ministry and for the health system. The creation, for example, of the popular insurance or the organization of the National Institute of Genomic Medicine, which has also been mentioned here. I would like for you to reflect something regard that period that you experienced, but in addition, the contribution made by Dr. Soberón when in the 80s, when he was minister, he articulated the efforts of the public education department with health. He perfectly aligned the field of training of human resources in healthcare, and he articulated, and I was a collaborator of his at that time, and I experienced it, the Interinstitutional Commission for the Training of Human Resources for Health, CIFRUS by its acronym. your reflections in relation to these issues, which were very important before leaving the health field. Thank you, Dr. Narro. I want to agree with this reflection regarding a person with a vision. In addition to the vision and depth, one of the aspects that amazed me about Dr. Soberón was the field, the inter-ministry aspects of different environments of the healthcare area. Obviously, we can talk about sciences and from the National University and talk about aspects of the School of Psychology, astronomy, and the area of biochemistry. But some things, a particular interest on issues of architecture and sculpture. He enjoyed boasting about a statue that is outside Funsalud, but on the side road of Periférico, it's a beautiful sculpture where he was very proud to boast about Professor Sebastian, who's also in several spaces. And one of the aspects maybe closest to my topic is that perhaps in the aspect of economy and health, he also had a very important role. I returned from studying. I returned to Mexico in 1993, but in those years of 1993, when he was already in the foundation, he sponsored a very important project on behalf of one of his disciples, Dr. Julio Fren, who was the document of economy and health, at that time sponsored by some businessmen from the foundation, that established the foundations for this aspect of economy and health. I think it was visionary at that time, both by Dr. Soberón and by Dr. Frink, and those ideas began to permeate the system. It is said that in politics, nothing is happenstance, and particularly in health and the reforms of the health area, nothing is happenstance, because what began in 1982 and 83 by Minister Cosillo, as Minister Cosillo told us, it generated a series of chain reactions that were generated, especially so that future generations of leaders in the field of health and ministers could understand how this right to health protection was going to be implemented in the operational level in states and physicians and all the parts that make up the health system. And one of them was to find now the coordination between the financial and budget aspects with law and make this right something that could be implemented. That was the reform that was created the popular insurance in 2003. It was implemented January 1st of 2004, that sought to provide resources for the health system so that the right to protection of health could be implemented, made a reality. It was an important reform in the area of health. Reforms come about by segments or sectors. Each one generate a complex of influences that change according to new visions of the parties. So I think that all of this was part of a great master plan that developed in interesting ways, where in all the areas, whether it would be the practice or the introduction of genomic medicine in Mexico, or whether it's the generation of institutions or the aspect of alliances with budgets, a great master plan came about, which certainly he had conceived. He didn't explain it to us in detail. Each one of us tried to understand how those parts would have to come together. But I think that that was a very satisfactory part of this experience of having participated in small reformations that built the parts to be able to achieve better health for Mexico. Unquestionably, and certainly it was good that you made the comment, because it was absolutely true and just. In addition, he shared with many of his disciples, he had the enormous capacity of creating work teams at different points in different institutions, and he did it obviously in the National University, and he did it in the Department of Health. but also when he participated and contributed with other institutions, he made up work teams that were adequate. And in several other institutions where he had participation with some of his disciples and colleagues. And this is the case of the National College and the Ministry of Health, where one of his very dear disciples, Julio Fring, was benefited permanently from the opinion, from the perspective of the master. But I'll move on to the topic of culture, the topic of one of the institutions of greatest importance in our country, the case of the National College. There, the Minister Cosillo is one of the members. He had the good fortune of sharing the sessions and work sessions that are organized in the National College with many of the brilliant minds and the greatest personalities of our society. I would like to ask him, the minister, what was the experience that he had with Dr. Soberon there, and that for sure, in addition, was discussed at other points, a topic that was passionate, that Dr. Soberon was passionate about university autonomy, where Jose Ramon is also one of our experts, and where he has contributed to clarifying and interpreting properly the scope and the sense. So, National College and autonomy, Mr. Jose Ramon, please.
El micrófono, José Ramón.
Ingresé al colegio, gracias.
I joined the college in 2014, and I purposed, by the decision of several of the members, I purposed to reorganize the college, the administration, the legal situation, and a number of things that had been unattended for some time. And the truth is, I should say that the one that I had the most conversations with to determine how these issues should be dealt with to be effective was with Dr. Soberon. We made many changes, and they're not even known and they are not noticed. That's the way good changes should be. Institutions should be transformed without any need to get applause and celebrations. And many changes were made. But there were two people that I invariably consulted, in addition to the other friends, Dr. Samudio and Dr. Soberon. And the steps that we took, the way of accommodating and regulating things, I liked the combination of the two because both had a enormously practical sense for solving problems. They weren't seeking to maximize when we couldn't maximize. So it was a fantastic combination. This same combination between Dr. Fink and Dr. Soberon that leads me to the topic of university autonomy. We should remember, and you know it, many of you know it, that Dr. Soberon took the National University in a very complex situation after the rectorate of Dr. Juan Pablo Casanova, and he had to make a series of changes and adjustments where it seems that they had not completely been resolved and harmonized and organized the entire conflict of 68, the situation that the country was experiencing at that time. And I think that with great intelligence, Dr. Soberon led the university toward a modern course, because if we go to Evarro Sierra to Soberon, we realize that there were several very difficult moments at that point for the life of the university. And I think that Dr. Soberon, with a very even-handedness, managed the university. But at the same time, he modernized it. He opened several important institutions, the whole cultural area of Salanetzahualcoyotl, and there were very valuable moments. And I think that he also modernized the idea of university autonomy. So I think that in that area, there are also two major contributions. In the National College, I have observed that there are people who have presence, shall we say, a major presence in the past, according to my investigations. Another eminent Mexican doctor, Ignacio Chavez, was one of these people who had an ability to organize the National College. Dr. Soberón also had it. In my experience, he spoke, he negotiated, he filled many roles in a body where there are 40 members and they're all peers, and it's not easy to carry out these processes of development and change at the same time, maintaining certain traditions. So I think this taught me, at least, because I had other experiences with Dr. Soberón in the National University when Miss Alarcón was there, Silvia Farcón, who was in the governing body um, in the University Council. I think these are experiences that I had seen directly, but I did like very much, and I learned a lot, I believe, in the way in which he had the capacity of harmonizing different interests, always trying to take things in the right direction, as Dr. Nato in his first participation of improvement, development, transformation, without fractures and interruptions, and trying to make the best use of the limited and scarce resources that our institutions have. So I did get this impression of a leader who led things gently, but with a tremendous effectiveness and tremendous clarity regarding the direction that he wanted to focus his efforts, not necessarily achieve all his results, but focus his efforts in this way of harmonizing. So I think there's a very important lesson there in political times that are very difficult in Mexico and in the world regarding how things can be done properly without destroying institutions, but to transform them in the best way. A personality of national life such as Dr. Soberon, who boasted that he respected those who thought differently, and in seeking conciliation of the different and various ones, and drawing people near and closer. And I had the good fortune, for me, it was a reason of pride to have worked close in different moments, uh, close to the university and the ministry, and benefit from his perspectives. And there in the National University, in his beloved uh, National University, he frequently mentioned that, or trying to establish what he was like, he would say, "Look, Pepe, I'm not contentious, but I know how to fight." And it was very interesting because he was a very decisive and strong and forward person that was always open to comments and always willing to find a agreement, a synthesis, always willing to resolve many problems through dialogue. He in the National University did a monumental work, so monumental that 50 years that will be fulfilled in a few years of his arrival to the National University, he is still remembered as an extraordinary rector. He mentioned or encouraged the decentralization of research. He developed the systems of national professional schools. He encouraged the development of culture and developed major spaces in the cultural uh, framework and the sculpture framework. So it was an enormous work, and he was a lover of sports and of his Pumas. And we will not reach an agreement with some of you. The guilty one already raised his hand because he was a full-blooded Puma uh, with no question about it. So just in that area, he would accept no other circumstance. So we are running out of time. We have a relatively short time, but I would like very much to discuss something, if you don't object, that Gloria Soberon, his daughter, said about him. And that has to do with another of the major aspects of Dr. Soberon, his human sensitivity. He was uh, a real light in this area. I would read and quote word for word what Dr. Gloria Soberon, his daughter, said about him. And I quote, "I believe that more than formal education, what he has left us is a way of living responsibly, but especially, Gloria said, with optimism and a sense of humor. And did he ever have a sense of humor? And from her, I also quote, if I had to signal out one of his qualities as the most important for me, Gloria said, for me, it would be that he is a good man in whom you can trust. All of us, the members of his family, as well as I am certain all of you, know that he is always there when we need him, willing to help us and to support us. And to paraphrase what Gloria said, I mentioned in a recognition of Dr. Soberón recently that he always found the time that he didn't have to help those that needed it. Any comment by you regarding this human sensitivity and this warmth that was felt and this support that he offered? Does any of you want to comment on it? I see Jose Ramon is raising his hand. Uh, yes, this aspect indeed of a great sense of humor, in addition to a very good sense of conversation and fellowship. When the sessions of the National College ended, we had some moments for conversation, and I tried to sit with him, and he would say, "Come sit here by me, Jose Ramon," and I would go and sit by him, and he really had conversations and very interesting stories. The one about the governing body of the university council that you would remember when they discussed if the rector or Carino should earn more money, and one of the university councilmen said, well, the day Dr. Soberon scores the goals that Cavino makes, we'll pay him what we pay Cavino with the Pumas. And since I like the historical aspects of the National Academy of Medicine, what had been the best doctor that he knew, he talked a lot about Dr. Laguna, and he had stories and more stories and memories and very practical aspects of life. And then in a group that, along with others, he participated in, that he coordinated as an inheritance for Dr. Subiran, some fantastic conversations, always remembering with a privileged memory. And he had many aspects of his life that he shared with us, and that was truly very pleasant, in addition to his enormous knowledge and professional capacities. But it was very pleasant to be with him in a strictly personal aspect, because he did transmit and teach, and especially he shared his experiences. I assume that with the purpose, never expressed, but with the purpose that other would learn from him and would be able to do things similar. Obviously not equal, but because he's an extraordinary talent, but similar to the ones that he had done. And that aspect was also very emotional, or good humor. And I should also say that I enjoyed that much for many years, the same aspect. Thank you, Jose Ramon. Eduardo, please, just very briefly, Dr. Narro, but it does come to mind a thousand things. Dr. Master Soberon had a phrase that we repeated frequently. We didn't know all of its implications exactly, but he said, if you're going to smoke a cigar, do it during your honeymoon. So, and at some point when I was also about to begin in the Mexican Foundation, you don't know this, Hector, but on behalf of the name of your position is due to Dr. Soberon, because he said if we're going to get along well with businessmen, the conversation that he said with the licenciado Vedrope, he said, what are you going to be? He said, I'm going to be the president of the council. Dr. Soberon said, if you're going to be the councilman, I am not going to be the general manager. I'm going to be the executive director, because if we're going to understand each other, we need to do it as peers. So there was a president and executive president, and I think that was part of the idea of beginning from the beginning with things clearly on the table, and smoke the cigar on the honeymoon so that there are not surprises afterwards. Thank you very much, Dr. Narro. Hector, please. Yes, Dr. Narro, I raised my hand because we had our football differences. It's true. always appreciated and respected, and always with good conversations and afternoons of conversation about soccer. And I remember for a lifetime that we talked about whether I should revisit my soccer tendencies, which I think is unlikely. But I remember the sympathy, the great tenderness and kindness and the human feeling that he always showed. But I remember two more things: the tremendous commitment to research and people's training. I think this is something that is really great. And what I began with, the first phrase when I said, a great lesson for all of us, Dr. Soberón solved problems. Thank you very much, Dr. Narro. On the contrary, thank you very much. I have no doubt that we could continue for a long time, many more minutes, talking about the life of one of the great characters of the second half of the 20th century and these first 2 decades of 21st century. A complete human, a well-rounded, a great person, very intellectual in the area of research and culture, in the development of institutions. But as always, time does not forgive us, and we have only a few minutes, 2 or 3 minutes, to be able to, and I would ask our host that they would give the final words and close this section of recognition to Dr. Soberón, and of course, to conclude the sessions of this forum. Eduardo, please. Thank you, Dr. Narro. Licenciado Sanders owes us more of these minutes, but out of courtesy to the entire audience, will be brief. I would just like to thank all of you. We always learn from people that were close to Dr. Soberón, people that know so much and has contributed so much to the health system. Dr. Narro, Minister Cosillo, Hector, is truly an honor to share this occasion of conclusion. I think we conclude with a golden nugget, this transformation, this form of knowledge and transformation. I think that this focus of Dr. Soberón and his commitment to education aligns with the message of the forum, and especially with Physicians' Day. These are three aspects that it would be difficult to align as well as they're aligned today. Mexico is great. Its health system is something that we should be very proud of. There are things that require improvements, but there are many things that have been the work of great people, people that have gone through different aspects, ministers of health such as you, Dr. Narro, and former ministers such as Mr. Cosillo, and officials and such as Dr. Valle. In that regard, what better than this close? It's Friday, we all deserve rest, but again, thank you to all the participants. There were thousands that were with us in this forum, and I think that this will be the first of several forums with the support of the British Embassy, the British government, in the framework of the Better Health Program, so that we can continue to explore these topics and continue to learn from the different experiences with other countries. We need to be open. We need to understand other systems and perspectives and concerns and successes of other countries and partnerships. In that regard, I am very satisfied and happy, and I learned a lot from this session and from the entire event. Thank you all. And with this, we conclude this session and this forum of knowledge and transformation.
Pues no sé si estamos escuchándonos. Nosotros ya estamos fuera del aire.
Sí se escucha, doctor.
Perfecto.